many of you know the fabulous Dr. F from Mountain View Veterinary Hospital. And she's just been checking on Mason, and we're changing his treatment plan a little bit. So she's going to explain what is going on and what we're doing about it.
So there's a couple of things, because Mason has type 3 kidney disease, and we've been watching his blood work very carefully, and we found out, or we've been noticing that his red blood cell count has been hovering around 20%, and and usually it should be ideally closer to about 30%. So Shelly and I we also contacted an internal medicine specialist, and because we can, we had the ability to bring in and give Mason some darbepoetin, which is a hormone to help him stimulate some more red blood cell production. So what we decided is that we would start Mason on some darbepoetin and some iron supplement, because when cats have kidney disease and it becomes chronic, the hormone to tell your bone marrow to make red blood cells comes from your kidneys. So when they've had kidney disease for a long time, they can become anemic, and then around the 20% mark is you can start to think about whether or not you want to supplement with that hormone. And it's actually a human product. There's two, there's erythropoietin and darbepoetin. We found that darbepoetin in cats, there's less chance of any side effects. So between Shelly and I, and also Dr. Mirkovic, we decided we were going to start some darbepoetin in Mason to see if we can get his red blood cell count up to about 30%, and that might give him some more energy. In addition, because we're asking his body to make more red blood cells, we also started supplementing with iron. So we gave him an iron supplement today. We grabbed one more quick blood sample, just so we know where his blood work was 2 weeks ago. But we're going to just, so that we know where his red blood cell count is today. And then next week, we're going to come back. I'm going to give him another injection of darbepoetin and take another blood sample and see. And we'll probably plan to give him one injection once a week for about 4 weeks. That's usually about how long it'll take to raise that red blood cell concentration by about 10%. We also did a little bit of investigating, because we noticed that Mason has a high calcium level on his blood. And that can happen usually in cats for a few reasons. Sometimes it can happen from the kidney disease. Sometimes it can happen from cancers. And sometimes it can happen for no good reason. So after some complicated blood testing, we found out that he has a high calcium level for no good reason. And in science, we call that idiopathic. So it means that science doesn't really know, but so that the extra calcium in his bloodstream doesn't cause him to have bladder stones or other problems. We started him on a medication called aldontrinate, which helps him, and he'll just get one pill once a week, and that will help bind extra calcium. In addition, Shelly's giving him some medication to decrease protein in his urine, also medication to bind the extra phosphorus in the food to help his kidneys. And considering how significant his kidney disease is, he's really still enjoying life.
He definitely is.
Mm-hmm.
He's very playful and energetic and comfy when he sleeps.
So we'll keep you posted about how the darbepoetin is hopefully raising Mason's red blood cell count, and we'll check it week by week, and we'll hopefully find out that he just keeps getting stronger despite having less than perfect kidneys.
That's right. He's perfect everywhere else. He's got places to be. Hey. All right, thank you for that update on Mason's health. So he's generally, though, feeling really good, and likes to chase Aura around, and who Aura seems to have become comfortable. All right. Oh, she's so cute.
She's beautiful. You're both beautiful.